Hello again. Welcome back, or welcome to our lecture series of how to not get a cavity or how to prevent cavities. My name is Dr. Peter Dinh, and I'm the owner of Atlanta Dental Team. Last time in our discussion, we talked about how biofilms form, the order in which we want to remove biofilms and bacteria. And so today, what I would like to have a discussion about is to talk about technique. Technique is king. Let me just say that. If you don't have the proper technique, you could be doing the brushing, flossing, water floss, or all of these things, and it's, would be for a waste. Your effectiveness level is something that all of us can work on and perfect. So until we've mastered the art of not getting cavities, we can always improve and focus on technique and habits. It's not exactly a sexy topic, but let's dive in, because a lot of times these things aren't taught. If you think about it, who taught us how to brush our teeth? Who taught us how to floss? Who taught us our at-home routines? For a lot of you individuals out there, the answer is nobody. You just try to have to wing it and figure it out. So today I want to go over each of the ways that we can care for our teeth. So let's start with brushing. Brushing, you want to start in a circular motion. The reason that we do a circular motion is because it removes bacterial biofilms in the most effective way. Okay. A lot of times when we brush in a way that just goes over the front parts of our teeth, forgetting that bacteria actually live underneath your gums as well. If any of you have been into a dental office before, hopefully you've had this experience where a dental hygienist or a dentist will start poking your gums. They're measuring the depth of your gum tissue. So at a probing depth of 5 millimeters, that's where, if you are brushing your teeth, you're not actually getting underneath your gums. Healthy gum tissue is between 1 and 3 millimeters. And so what does that mean to you? It means that we have to actually clean underneath our gums. This means that on the front surfaces and the back surfaces, we clean them by angling the toothbrush toward our gums. So not a perpendicular brushing technique, but kind of angled at 45 degrees. So if you're taking a toothbrush, it's not just like this facing towards you. You're actually angling it upwards if you're going on the top teeth, okay? And if it's on the bottom teeth, you're angling it on the bottom. But our teeth aren't just in the front, they're on the sides too. So if you're angling it on this side, you don't want to be just perpendicular. You want to angle it down if you're on the lower teeth, 45 degrees, and you want to angle it up 45 degrees on the upper teeth. A lot of people just keep it this, and they just keep on doing this brushing motion, and it's not a circular motion, it's a brushing motion, and they're not cleaning underneath your gums. This could be part of the reason why you're constantly getting cavities or constantly getting those deep cleanings, those gum infection therapies, those scaling and root planings, and they can be expensive. So a little bit of a tip there. The second tip I would suggest with the brushing is, I know you've heard this before, and if you haven't, hey, welcome, I'm glad to introduce this to you, is having 2 minutes of brushing, okay? So if we're breaking this down, us dentists, we like to break down the mouth into 4 different quadrants: upper right, upper left, lower right. And so that means if you're brushing for 2 minutes, it's 30 seconds each quadrant. It's obvious stuff, but it's something that we actually really don't pay attention to. So my suggestion would be you can put a timer on your phone. You can put it for 2 minutes, and then you just look at every 30 seconds, you switch the quadrants. It might feel, and it actually not might, it will feel like an eternity when you're actually brushing your teeth for 2 minutes. But if you're getting cavities, or if you're getting those scaling and root planings and periodontal therapies, this is one area of opportunity to level up in. That's brushing. I think that pretty much covers it, other than, manual brushing is not as effective as an electric toothbrush. So if you're having issues or trouble, brushing your teeth and decreasing those cavities, I would suggest considering getting yourself an electric toothbrush. For today, I won't go into the different types of electric toothbrushes, but the big names are Sonicare and Oral-B. Something to consider. You can get something on Amazon. It's going to be a very good investment, because a cavity, doing a filling, might cost you, if you don't have insurance, might cost you a couple $100s. An electric toothbrush might help you prevent cavities on all of your teeth, all 32 teeth, and you can get a lot of savings there, future savings there. So that's brushing. In terms of flossing technique, the biggest issue that I see with my patients is that when we floss, you kind of pop it in and pop it out. Now, if you analyze that technique, you're basically cleaning kind of a very small surface area around the teeth, basically where they touch. Now, in a sense, you can make the argument that that's extremely helpful, and it is extremely helpful. That's the number one or number two area that a person gets a cavity, is right where the two teeth touch. So if you're popping it in and out, I would say that doing it is better than not doing it at all, okay? But there are levels to this. People that have never gotten a cavity their entire life, they have a little bit of a different flossing technique outside of just popping it in and out. You've heard maybe that you want to make a C around your tooth. So as you pop it in, you wrap it towards one of the teeth, okay? The gum tissue is a little triangle, so you want to be on one side of the triangle. You pop it in, you go to one side of the triangle, make a C around the tooth, and then you scrape it up and down, okay? I would say that's probably like level 2 flossing. If you can pop it in, go to one side of the papilla, the gum tissue, come out, don't unpop it, and go to the other side of the papilla and go up and down. Now you fully clean both sides of the gum tissue there, all right? So that's like level 2, level 3 kind of action. As you get further and further, you kind of develop a tactile feel. You can kind of imagine the feeling in which your tooth and your floss interact. We're getting into voodoo magic now, potentially. But basically, you can feel how clean the tooth is. If you floss up and down 1 or 2 times, you can pull the floss out and you can see the bacteria there. You can see the biofilm. Some people wash it, some people spit it out. Some people eat it, no judgment here. Just cleaning it out in between your teeth is the goal. So the next level is to really try to get a relationship where you are flossing in and out, but flossing it up and down until you really don't feel any more bacterial biofilm. Okay, there are levels to this. Okay, the last step to consider, I would suggest, would be to consider getting a floss that works with your teeth. All right. If you're getting a floss where every time you put it in, you're tearing the floss, you need floss that has a little bit more glide in it, so a little bit more waxy stuff. Now, wax is a little bit controversial because there are things in the wax that aren't exactly healthy for you. But, if you can floss and make sure you don't eat that stuff and spit it out, I would suggest that that's probably better, because having the bacteria in there, in your mouth, you're basically eating bacterial endotoxins, and that's not a good thing. We know that periodontal disease increases the risk of heart disease, stroke, cardiovascular issues. So I would suggest trying to get rid of the bacterial biofilms there. I personally, I like floss that's unwaxed and that have a little bit of friction in there. So imagine your dishwasher sponge, right? And imagine if your sponge was very smooth versus had a lot of porosities in there. The fact that it has a lot of porosities allows the sponge to have a little bit more friction, and that friction allows you to remove more debris on your dishes. So the floss that you want to have something that is, I don't say really stringy, but has a lot of friction, has a lot of kind of like mechanical roughness towards it. If you have a little bit more of that, it's a little bit stronger at removing that smooth biofilm layer inside the bacterial biofilm. And so that would be kind of the ideal floss technique. So again, just to summarize, you want to pop it in and out. You want to make a C around the tooth. You want to go up and down. You want to try to imagine all of the bacteria going away as you're going up and down, so that you know how many times it takes to go up and down. And then lastly, you want to make sure you use something that has a little bit more mechanical roughness on it. That way you can remove the bacterial biofilm. Okay. That does it for, I think, the floss technique. And again, flossing is better than not flossing. Talking about flossing, if you're really struggling with flossing or it's not working for you, sometimes it's a behavioral thing. So these days, especially with iPhones and Netflix, these companies are designed to steal your attention. When your attention is stolen, it's very hard to do things like build a new habit, floss. So I totally get it. So a couple suggestions that I make with my patients would be to put your floss in an area that you hang out in. So for example, right next to your TV, so that when you see it, you're like, huh, my attention is taken, and you just pick it up and you start flossing. Okay. Another attention grabber, I took this from Kevin O'Leary from Shark Tank. One of his entrepreneurs, or actually it was a she posted a Post-it note on the mirror or in a place that they see often to remind them to floss. So you can also make an alarm at a certain time each day to floss. That can be pretty helpful. So that would be kind of tips to help get you to floss, because I know most people brush more than they floss. Most people don't floss. Most people find it difficult to get their attention to floss. So I get it, totally get it. So here's some solutions for you. The other part of the flossing game is basically, if you're having trouble flossing, then a water flosser, a water pick, or an air flosser is something to consider. Okay, studies show that a water pick is equal to the level of flossing when it comes to removing bacterial biofilms. My suggestion is do your best to at least do one. If you can't do the one, then try your best to at least brush. But if you can do one, try to do two, because as you get older and your gum tissue start to recede, you start to have more issues, and everyone goes down the same path of using some sort of water flosser. So I try to do it every day, just because I don't like my teeth drilled on, and I don't like those deep cleanings. I don't like needles. And so if you're the same type of person like me, let's get on the water flosser too. So this is one example of a water flosser. This is the Philips Sonicare. Again, there are lots of stuff out there. Using one is better than not using any. The challenges with water flossers is that it spits out water. It's like a little squirt gun, and that it gets messy. And so people tend to not use it over time just because it's messy and a hassle. So what you want to do is you want to angle your head and almost like tilt your head as you're using each quadrant, right? You're going to the bottom, you put it in your mouth, kind of tilt your head, and you either want to do one of two techniques. You're going to hold the water in your mouth until it gets too full and then spit it out, or you're going to keep your mouth slightly open like this. And as water squirts in, it'll slowly dribble out. So you have to put your head over the sink. So a little bit of a hassle, but it has really good results. And we recommend it for all of our periodontal patients, people that have periodontal disease, which is kind of level 2 of gingivitis. If you don't know what gingivitis is, itis means inflammation, gingiva is gum tissue. So gingivitis is inflammation of the gum tissue. You get that whenever you bleed, whenever you floss or you brush your teeth, you bleed your gums because there's a lot of inflammation there. So that would be the water flosser technique. The last technique is using mouthwash. And again, might be common sense for some, might not be common sense for others. And I'm sure some of you can improve this technique as well. Basically, when you put mouthwash in your mouth, you want to basically violently swish your mouth and create that vacuum. The more violent you can swish your mouth, the more you're basically removing and pushing out those biofilms and killing the bacteria. You're adding air into a biofilm. In our previous discussion, we talked about aerobic bacteria and anaerobic bacteria. So if you're pushing air into the biofilm, you're basically introducing oxygen into the biofilm and you're killing bacteria, okay? So when you put the mouthwash in your mouth, don't just put the liquid in your mouth. Make sure that there's a component of air. I know we're getting detailed here, but make sure there's a component of air in there so that when you swish, you can feel that movement of air, okay? That's kind of level one, maybe level 1 and 2, using mouthwash, introducing air. As you get to level 3 and level 4, I would suggest to consider basically understanding the tactile feel as the mouthwash goes into your mouth, okay? So basically you can feel certain areas of the mouthwash going into specific teeth, okay? So if you notice, hey, I got a little sensitivity in the upper left side, don't know left and right, that's not good. If I notice, hey, I got some sensitivity on my gums in the upper left side, let me concentrate and swish liquid in that direction. The goal is to try to push the liquid in between your teeth through the gum tissue, okay? Because the only way to clean the gum tissue is through flossing or swishing your mouth. If you're just swishing like this, going in and out, you're just cleaning the outer surfaces of your teeth and your gums. What I want you to do, if you want to get to the highest level of mouth washing technique, and I know this is super cool and super nerdy, I get that, but if you want to get to the highest level of reducing cavities and saving money, you really want to try to concentrate swishing that water through the gum tissue and in between the teeth, okay? Takes a bit of practice, but those of you that have never gotten a cavity and that really have high level technique, you know what I'm talking about, okay? Those are the techniques that I have presented for you today. The last thing is, hey, you can brush and floss and do all of these techniques after every single meal. You definitely want to do it in the morning as you wake up. You also want to do it at night, right before you sleep. The most important time is right before you sleep, because you are laying down and you're letting the bacteria grow in your mouth for 8 hours, 7 hours. And so the cleaner your mouth is, if the bacteria doubles every 30 minutes to an hour, you have less bacteria that can double. So something to think about and consider. Congratulations for getting to this step. I'm glad that that you've allowed me to join you on your tooth journey. Best of luck, and hope this was valuable today. Good luck on your tooth journey there. My name is Dr. Peter Dinh.